Hi, so my video today is to give you some tips for when you have acute back pain. I had a client today who had done something over the weekend. She wasn't quite sure what had happened, but she felt that her back was going to give way. Every time she moved, it was like, oh, I can't do that because my back is going to give way. So often that's acute muscle spasm. And what you need to do is kind of reset. So you need to get your deeper core muscles working so that the surface back muscles, the ones that are giving that kind of going to give way feeling, they can relax. So what you need to do is hop down on the floor. Now, the simplest thing to start doing is passive extension. So hop down on the floor. You might need somebody to help you. You might need a stool or something to help yourself get down there, but you want to be on your tummy on the floor. Now, sometimes you need a pillow underneath your tummy to be comfortable here if your back is really acute. If you don't need the pillow, you can start by doing passive extension. So arms are just by your sides, feet are hip width apart, and you want to use your upper body to push you back up into lumbar spine extension. Now, all you want to do is just go in the range that's comfortable for you. You're keeping your bottom relaxed. You're using your upper body to push you up. Your chin can stay a little bit tucked. Keep your shoulders away from your ears. Generally, you need to do about 10 of these, and 10 at a time is enough. You might need to do these every hour for the whole day to help your surface back muscles to relax. So we call these passive extensions. The other name for these is Mackenzie exercises. So 10 of those each hour, okay? The other thing to do is roll over onto your back, okay? Be on your back, knees bent up. Some simple things like hugging your knee in towards your chest with either the knee bent up or the other leg stretched out is a nice thing to do because you're going to get a little bit of movement into your back, and you swap that over. So if you're quite acute, it would be enough just to have the knee bent and hug this one into your chest, and you keep alternating. Make sure you're breathing. A lot of the time we go into a bit of a panic when we have back pain, and that upper chest breathing means that you're not going to use your core muscles. So some alternating knee to chest stretches, pelvic tilts here, so squashing the lower back into the floor, gets a little bit of gentle flexion extension happening into your lumbar spine. So these are mobility exercises. You're not pushing into pain, you're just observing pain. And you might find that you cannot lay on the floor without a pillow underneath your back, so you'd use a pillow. The next exercise you can do is a bent knee fall out. So we're in neutral. We're going to do right knee out, somewhere between 1 and 2 o'clock, back to the center. Left knee out, back to the center. So we're trying to let upper body relax. We're thinking about our breathing as our knees coming out to the side. The knees are just going somewhere between 1 and 2 o'clock and 10 and 11. And your lumbar spine stay neutral. You're not letting your back squash or lift. And what we're doing is we're just getting those deep tummy muscles working at a very gentle activation. So you do perhaps 10, 15 each side. All right. Next exercise, bridge. So bridging, we need to bring heels a little bit closer to the bottom, okay? We can gently tilt the pelvis so the back flattens into the floor. We want to push into our heels, squeeze our bottom, lift up so that knees, hips, shoulders are aligned, okay? And then we're coming down. Now you might need to come down as a block, so you just bring your bottom down and then you have a little relax, okay? I'll show you how to do an articulation on the way back down this time. So we tilt the pelvis, we squeeze the bottom, we push into those heels, we lift up. All right. We're not
not holding your breath. Now you can articulate on the way back down this time. And then we relax, okay? So I do up to 10 of these if you were in acute back pain, as long as you found that you were squeezing your bottom muscles, you weren't getting any pain in your back, you're not overarching here, you're keeping shoulders, hips and knees aligned. And then coming back down. Good, I'm going to do 2 more. So really important you keep squeezing the bottom. So you're using your bottom muscles to push you up into hip extension. So the surface back muscles aren't having to work here. So again, it's that idea of using your deeper muscles, using your glutes to help relax that surface back muscle spasm. Alright, so this is the last one. I'm squeezing my bottom the whole time up here. I keep squeezing until my tailbone touches the floor. Okay. Another thing that is helpful with acute back spasm is piriformis stretch. So we put the ankle on the opposite knee, we bring the knee in towards the chest. It will stretch through your bottom. And if your back pain is giving you sciatica or pins and needles, this can often feel really good. If you find that the pins and needles or numbness or sciatica's got worse with any of these, you'd stop doing them. And of course, if you're unsure, go and see a physio. Alright, we do know that exercise is the best thing that you can do if you have back pain. Alright, and then we're going to lower that leg down. Alright, leg stretches, great thing to do. I've got a heavy resistance band here. I'm going to pop it around the ball of the foot and stretch it up. So I'm going to pull on the ends of the band till the elbows rest on the floor. I'm sliding that leg along the floor. If you are uncomfortable with that leg being along the floor, you could just bend the knee back up. All right, and you're just getting a hammy stretch here. So a slight bend in the knee, you're feeling the stretch through the hammies there, and then you can just do some gentle foot movements. So we call this a sciatic nerve mobilization. And you do maybe 10, 15 movements of the foot back and forth. Alright, and then we slide that leg down. Now we can add in, if we put both ends of the band into the opposite hand, we can bend the knee and we can draw the foot across so that we're getting a glute stretch again. So sometimes this can be an easier way to stretch the bottom muscles if you found the figure 4 stretch uncomfortable. Alright, and then come back. So to stretch on the other leg, simplest way to do it is to put the feet in the air, swap it over, okay? Again, knee stays bent up if you're uncomfortable with it stretched out, otherwise stretch that leg out. And again, you're after a hammy stretch, so a slight bend in the knee. You want to pull on the ends of the band, relax your neck and shoulders. And then once again, moving that foot backwards and forwards. Breathing normally down into the diaphragm. And once again, we'll do that stretch on the glutes. So we bend the knee, we bring the leg across, we've swapped the band into the other hand, and we're just aiming for a stretch in the bottom. The knee and the foot are kind of angled over. Well, my knee is angling towards my right shoulder. And then we relax. So we hold a stretch for about 20 seconds or so. Let's take the band out of the way. So we've done a bend knee fall out, we've done bridging, we've done some leg stretches, glute stretches. If you've got a little resistance band, you can also find that by putting it over both knees, this is a nice exercise again. It just works the tummy a little bit harder, and sometimes that really clues your brain into getting your deeper muscles working. So we're in a neutral lumbar spine position, palms facing up. We're going to have feet and knees hip width apart, and we're just going to do a gentle bent knee fall out now against resistance. Remember your breathing, ribs aren't poking out. You can alternate the sides, and you are using your bottom a little bit in this position as well. So nice and slow. You could do up to 10, up to 15 on each side. Remember the breathing. Let the neck and shoulders relax. I'm going to do one more each side just to demonstrate. Okay, and then I'm going to just bring those knees in, take the band off. Alright, okay, I'm going to roll onto my side to show you a windmill stretch, which is essentially a thoracic spine stretch, but often I find people, if they're fearful of moving their back because they're in pain, their upper thoracic spine or their thoracic spine gets stiff. So this one is necessary to help you relax muscle spasm. Alright, so we're on our side, pillow underneath your head. I haven't got a pillow, imagine pillow there. We're going to slide that top hand over the bottom one, bring the arm up and over. The knees stay glued together, so what you're actually doing is thoracic rotation. Your lumbar spine's not moving because the knees are together. So we use our breathing, and you're thinking about the upper shoulder blade getting towards the floor. We do a little bit of a reach forward, which is protraction. Bring the arm up and over. Alright, about 5 or 6 each side. Alright, and with the last one that you do, you want to hold that outstretched position. Breathe in. As you breathe out, go a little bit further. So the knees haven't moved at all. Alright, so you do the other side. I'm going to skip the other side and come up onto my hands and knees. I'm going to show you a frog stretch. So frog stretch, really nice back stretch. So my knees are apart, my bottom's coming back to my heels, I'm stretching my arms out in front. Your head can rest on the floor. So you're giving those big surface back muscles a big stretch. You can use your breathing here to help, and then relax. Alright, I'm going to come up and show you a hip flexor stretch. Okay, often those hip flexors, they attach onto the front of the vertebrae. They can get really quite tight, and that's why you think that you're going to hurt your back when you bend over and you get that spasm. Alright, so we want to be kneeling. My head's missing, but I can talk you through this. So we want to be in a kneeling position, put a pillow underneath your knee if you need to. We tighten our tummy, we tuck our bottom under. So that's a pelvic tilt. I do that again. Tighten the tummy, tuck the bottom under. So you'll feel the stretch at the front of the hip, and you stretch in your hip flexor there. So hip flexors can spasm, that's why you feel like you can't bend over. Alright, so you do the other side, and then you should be able to stand up. Alright, I'm just going to sit. So best thing you can do is passive extensions. That was the first exercise I showed you. 10 every hour. They're first aid for sore backs. If you find that they actually aggravate you, you're better off doing flexion type exercises. Bring your knees in towards your chest. Alright, all those exercises are designed to decrease back spasm. If you find that none of that helps, you need to see a physio, okay? But generally, don't stay in bed. Movement helps. A walk, 10, 15 minutes, nothing too strenuous, is better than laying and doing nothing. Generally, most back spasms will settle down if you can think about your breathing, not catastrophize, and get back into some normal movement. I hope that helps. Let me know if you have any further questions. Bye.